Well, I need to say good afternoon to everybody as we come together to follow up on the questions and giving answers to the program that was launched last weekend, Surviving a Pandemic. And I would love to thank our speakers for giving the time to be with us and answer some questions in this panel. And so I would like to thank Dr. Bruce Webb for being willing to spend time with us again, Dr. Evelyn Inchamwenga, and then Renier on. And I would love to thank our
I think the folks will just have to mute.
All right, there we are. We've just had an echo there. So we want to welcome you all to this program. We're gonna answer some questions. There's quite a number of questions that came in, and I believe it would be a good thing if we just do a short prayer before we start. Let's just pray. Our gracious Father, we welcome you to this program. This is a Christian broadcast. We would like to invite you to be with us, to give us wisdom so that we can answer these questions in the way that would exalt your name. And we thank you for all our speakers that made themselves available today. And we ask a blessing on this event, and we ask this in your holy name. Amen.
Amen.
Well, once again, Dr. Bruce, Dr. Evelyn, Renier, you are welcome. I was one of the speakers as well, so I'll answer some of the questions. I'm Arnold Neuhoff, and I'm gonna go over to broadcasting some of the questions that we've had. If I can get to the right button to do that, and there we are. I think we'll be on. Are you able to see the opening slide?
Yes, we are. Thank you.
Thank you very much. So, Dr. Bruce, the first question that we would like to present to you today is the question: I've been struggling with not being able to sleep properly for 7 years. How can I gain my sleep back? Please help, because of the lack of sleep, I'm struggling with headache.
Okay. Can everybody hear me? Nice to see you all and be with you all. This is a big question, but I'll try and break it up into little parts. Might be useful to take some notes if you're the one asking the question. But any problem in medicine, you must take a systematic approach. And it must be borne in mind that one symptom, and now we're dealing with a symptom here called insomnia. So insomnia is a clinical manifestation or clinical symptom. One symptom in the body can have a number of different causes. That's important to understand. There's not one cause for one symptom. So just like headaches, there are many things that cause headaches. There are many things that cause insomnia. And something that's really important to understand is that, and this I see very often in, people that are very well-meaning in health circles, everybody wants to be healthy. But what's got to happen is, before you can manage a problem, you have to diagnose the problem. So I always say to my patients, diagnosis precedes management. This is a fundamentally important thing to come to terms with, because what happens is, and the reason I mention that is, sometimes people have a symptom and they'll go to a health shop or wherever, Dischem, and they'll say, I want something for headaches, and they'll get X. But as I said, headache is a symptom. It's not a diagnosis. So that's important. So we got to say, listen, insomnia can have many different causes. That's the departure point. So I can't say, do X without going through a process with a patient to say, what's the cause of insomnia in this patient? That being said, as the backdrop, I'm going to give you a framework as to how to approach insomnia. So there's different types of insomnia. There's initial insomnia where you battle to fall asleep. There's middle insomnia where you wake up in the middle of the night and then go back to sleep. And then there's terminal insomnia, you wake up right in the early hours of the morning. But basically, like I said in the lecture, you've got to start with the simple things. Look at the environment. Firstly, what is your sleep environment like? Is it conducive to restful sleep? Do you have a comfortable bed? Is your room dark? Do you have a comfortable pillow? Do you have peace in your home? You know, if you're going to bed having just had an argument or fight, you're not going to sleep well. With someone that's had long protracted insomnia for this person, like for 7 years, there's probably a persisting physiological cause of insomnia. But to keep it simple, we're working from simple to more complex. Sleep environment. You must work on your sleep environment as the starting point. Make it conducive to going to sleep. Secondly, you want to practice sleep regularity. You want to make sure that you're going to bed early and at the same time. You don't want to, your body likes and your brain loves regularity. You don't want to be going to bed at 8 o'clock one night and 12 o'clock the next night, because we operate on cycles. So you want regularity. So sleep environment, sleep hygiene in terms of regularity. Next thing, are there any untreated, like I said, psychiatric or mental health conditions like anxiety, depression? This is key, because ultimately, if your physiology is normal, if your hormones are normal, if you have an anti-inflammatory state, if you are not, toxic, if you're a healthy person physiologically, and your brain is healthy as a consequence, then by all intents and purposes, you should sleep well. So the brain is the final manifestation. Like I said to you, the brain, your sleep is a barometer of your health, because to sleep properly, you need a healthy brain. And so we've said sleep environment, sleep hygiene in terms of regularity. And now we're saying things like, what is your brain balance doing? Do you have, as I said, untreated anxiety, untreated depression? Because to sleep restfully, like I said in the lecture, your brain needs to be able to switch off. We've got that system in the brainstem that makes us alert during the day called the reticular activating system. That activates the frontal cortex, or the whole of the cortex really, and keeps you alert. So we're talking to each other, we engage now. My reticular activating system is making sure I'm awake. When it comes to nighttime, there's a reversal of the neurochemistry, and there's a different set of neurotransmitters that become operative. And so when people are burnt out, when they're stressed, you wear out some of those neurotransmitter systems. It's like, it's putting it very simplistically. If you put your car on full tilt the whole time, if you ride it with your foot flat without ever taking your foot off, that's what people are doing with their brains. We are so stressed and tired and wired that we're exhausting our neurotransmitter supply. And so we have brakes of the brain, we have accelerators of the brain. We need a balanced neurochemistry to be able to sleep well. Next thing down, so working top down, we need to go brain, nose. How am I breathing at night? Do I snore? Have I got nasal patency, like I said? If your breathing is disordered at night, you won't sleep restfully. And you can actually wake up without fully waking up and not realizing that you're waking up. Next thing is hormones. So hormones, particularly at the time of menopause, burnout, adrenal issues, these things have a fundamental effect on sleep quality. The brain needs a balanced hormone profile to be able to switch off at night and to regenerate and repair. So that's important. And whether or not, then simple things like whether or not you're eating late at night, whether you're nutritionally depleted, whether you have enough magnesium, enough nutrients, enough tryptophan, enough B6. So that would be a general framework I would approach a patient with, starting from simple to more complex, but that would be the framework I would use. And you would need to see which of those apply to the person that posed the question. I hope that provides a framework.
Thank you, Dr. Bruce. We appreciate that. That's a good answer. Dr. Evelyn, there was a question, when you speak about pathogens, is that like the coronavirus? And I think you have given us a slide that you want to explain.
Yes. Good afternoon, everyone. It is indeed a pleasure to join you once more to answer these questions that you have for us. So when we say pathogens, it's basically a term that speaks of the organisms that are disease causing. And yes, coronavirus is one of these organisms. This slide is just to show you the different groups of organisms that we're talking about. So we have organisms that are said to be living or cellular, meaning they have cells that are able to function on their own. And we also have acellular or non-living organisms. So for the cellular organisms, we're speaking of parasites, such as tapeworms, protozoa. Something common is malaria, especially from where I come from. There's also the fungi, which causes things like athlete's foot, and prokaryotes, basically bacteria. An example is tuberculosis, leprosy. For the acellular group, we have the viruses. A good example is the HIV virus, coronavirus during this pandemic. And we also have what we call prions, which are acellular. So basically, this is an overview of what pathogens are, and I hope that answers your question.
Thank you, Dr. Evelyn. Renier, we've got a question for you. Where do I start to switch over to plant-based diet? Having a 15-year-old son and a 19-year-old daughter that is not interested, what would be the basic shopping list to start with?
So when it comes to your lifestyle changes, as I've said in the presentation, this is not necessarily a diet, but rather a lifestyle, a total change of thinking, a total change of training our taste buds so that we can become more accustomed to what we are not used to start eating that and exploring this whole new world that is out there that many people are not aware of, but yet many professionals in the world, many popular people in the world have discovered it and have really gone on to this bandwagon of eating what God prescribed in the beginning for his people. So that's just the first point. So it's a lifestyle. Now, when you have a 15-year-old and a 19-year-old, it's not always the easiest thing to just change things drastically in your home that they would go along with, because they won't be interested. Used to eating all the things that they've been provided for the last 19 or 15 years. So a basic place to start is to start small and then gradually implement new things into the home that are well-tasting food, something that really tastes nice. And therefore, I would also always recommend get some recipes online, do some research, especially as the mother, as to what you can do so that you can, make nice and tasty food. So start with something small. Don't start with something big. Start with something that is still delicious. For argument's sake, let's say you used to eat Simba chips in your home, and the chips that has the MSG in, all the bad E-codes, that's not necessarily the best for us. And I know Pastor Arnold's got a good talk on these E-codes that are in these packets of chips. Change those chips rather to something more healthy. Go and look at the labels that, the lightly salted Lay's that doesn't have all the E-codes, or nachos, the lightly salted one there, that doesn't have all these extra ingredients in it. So if you introduce this to your children, it is still something lekker, as they say in Afrikaans, or something nice to eat, but it's already a healthier option. So gradually you're making them used to this new lifestyle. Then take on the next thing. Just one day, I don't know if you guys drink tea or you drink coffee in your home, then change one of those. Go and buy yourself this chicory at the shops. Now I see it's freely available. It's this purple bottle. It's a chicory coffee. It's got no caffeine in it, and it's healthy for you. Then change your Rick coffee or your Nescafe with that and just give it to your children. And what do you think of? Don't even tell them, just make it and give it to them and see how they respond. So then the next thing is change. So basically is we need to ask God for wisdom. He knows your children, and it's to take one step at a time. Don't try to take on Mount Everest in one day, but rather take small steps that will lead to a healthier lifestyle. Change your salt. Your table salt that you're using, change that to Himalayan salt. Your children won't even know. If you like to use pepper, change your black pepper to cayenne pepper. Once again, your children won't know. They will still taste pepper, but it's the healthier option. This way, we're eliminating the bad stuff and adding the good stuff. Another example is take out the sugar out of the coffee or out of the tea or out of your porridge and just add honey to it. Once again, it's something sweet, it's something nice. This way, your children will gradually get used to it. If you want to move from, let's say, eating less animal-based foods to more plant-based foods, then just once a week start incorporating beans and lentils into your menu for what you make for your family. And that way they would taste it once a week and they get used to it. And then next, let's say a month or two later, you start adding it twice a week. So you're gradually taking away. I think the worst thing that we could do as parents is if we take everything away at once. The children would rebel. They're not used to it. They don't want it. So it's to take small steps. Think out of the box. Ask God for wisdom. He wants you to eat healthy, so he'll give you the thoughts what to follow to eat a better lifestyle.
Thank you very much, Renier. Well, there was 4 questions around juicing directed to myself. And I'm just going to go through these questions quickly. I want to find out, is juicing also as healthy as eating raw fruits and vegetables? And then there's another one, how long can a person do a juice fast? Are smoothies okay? And then I'm recovering from chemo and radiotherapy for breast cancer and keeping the New Start principle, but I have a few concerns. How much juice, apple, carrot, beetroot per day, and when should I have it? Well, you know, juicing, it always depends on what your goal is. If the body is in need of intensive hypernutrition for a short period of time, then juicing is okay. Having said that, would it make sense to say that if God thought we needed lots of juice every day, that he could have created a carrot, for example, as a bag of carrot juice instead of a veggie to be well chewed on? And I think that is something to think about. Or does he favor those who can afford a juicer against those who cannot? Now, I cannot afford a juicer. I don't have a juicer. So why did he give vegetables with so much roughage in them? Because it's clear that our microbiome, our good germs that live in our digestive system, only live on roughage. So, and I want you to remember that this microbiome is really the center of our immune system. So, yeah, roughage is the only thing that we get it from is from food, from plant food. So roughage enables these good helpful germs to stop inflammation, to play a major role in the prevention of most chronic diseases. And in summary, it's fine to have extra veggies in juice form if you're not well or just for enjoyment here and there. But it should never take the place of eating a wide variety of fruits and vegetables over a period. And if I talk about a period, I would say, you know, in a week's time. It should not be there all the time. Now, you know, it just depends on a juice fast depends on, you know, the circumstances of the person wanting to do this fast. We often tend to overdo what we are doing. As human beings, that's what we do. So when we start fasting, you know, we want to take it as far as we can. I wouldn't recommend a fast longer than a week because your survival depends on the roughage found in your diet. And we are talking about sure where we've lost each other. I want to welcome you again to our program. Survivor Pandemic Questions and Answers. And once again, the question that was posed to us was this question on juicing, and how long should a juice fast be? And what I do understand, and what I do and I have experienced over many years, is that it depends on the circumstances. You know, a 7-day maximum for a juice fast. Your body needs fiber. It really needs fiber. Your microbiome, that is the center of your immune system, depends on the roughage that you eat, and your immune system depends on that microbiome. So it is important that we would keep that in mind as we make this decision. So I need to remind you that it is the good germs, the probiotics, the microbiome that lives on roughage in your digestive system. And we know that eating enough roughage is one of the most important decisions that you can make if you value good health. So we need to start your healthy journey with this specific one. Then there was another question in the same line, and that was, you know, are smoothies okay? So smoothies now and then is okay, but not every day for nutrient intake. Some people, we get lazy to chew, you know, and the smoothie it's easy because you just have to swallow. And the fact is, we need to chew our food to affect proper digestion, especially when it comes to carbohydrates, where digestion starts right here in our mouth. A smoothie, we just swallow. It means it is not chewed and therefore not mixed with the needed digestive enzymes, and digestion is therefore compromised if I would go that route. The last question that in this first round that I got was on this line is I'm recovering from chemo and radiotherapy, breast cancer, keeping the new start, but I have a few concerns. How much juice, the apple, carrot, beetroot per day should we use? Now, I would make a juice with apple, carrot, but I would put greens in there, like kale, like celery, like parsley, spinach. You know, it's like giving yourself a brand new blood transfusion if you do that. There's one little molecule difference between the green found in these things and in our blood. And so, you know, a little bit of beetroot with that. I don't claim to be an expert in this field, but therefore I can't, you know, advise most intelligently. But at our centers, we usually have 1 glassful about half an hour before a meal for cancer recovery. And I found hydrotherapy, sunbathing, getting the body system pH alkaline, avoiding xenoestrogens, those are most important. So yeah, if you need more information, just make contact with us personally, and we'll give you more information on that. Dr. Bruce, are you ready for a question?
I am.
All right. The question that I have here is, I'm diabetic. I'm in my menopause. I'm trying to eat healthy and exercising. But of late, I've developed some pain just below the chest and short breaths. I feel like coughing in May, but I never coughed. Sometimes I have to force myself to cough. It feels my chest is playing up.
Okay. So that's quite a bag of symptoms, but again, it depends. So when you approach a problem, you need to take, medically speaking, you need a history. You need to do an examination. You need to think of appropriate investigations, make a differential diagnosis of what you think the problem is, and then you make the management plan. So if your symptoms are, one has to decide, are your symptoms in your chest or are they in the upper abdomen for a start? So you said that it was mentioned that the pain or discomfort was slightly below the chest. So it might be in what we call the epigastric area or just under the Ziffy sternum. So If it is indeed in that area, then you would need to consider things like reflux or heartburn. You'd need to consider dyspepsia, which is, part of the reflux is part of that symptomatology. So that's essentially, we divide the gastrointestinal tract into 3 regions embryologically: the foregut, the midgut, and the hindgut. This upper part of the abdomen corresponds with what we call foregut pathology, which tends to be the stomach and duodenum or pancreas and liver. And so those are the organs that can cause symptoms in this upper part. Most commonly in a diabetic, of course, as well, one has to consider reflux, like I said, because if your diabetes has been poorly controlled over time, you can get what's called gastroparesis. You can affect the nerves that control the movement of the stomach and the intestines from the diabetes, and that can lead to reflux and increased reflux risk. So to answer your question, you need to differentiate, is this chest pain or is it abdominal pain? If it is indeed chest pain, which is now above the xiphisternum, then it's a different set of causes. You need to consider, is this coming from the heart? Is it from the lungs? Is it from the joints of the chest, something called costochondritis? So there's a whole hodgepodge of things it could be. And speaking to your primary care doctor, your GP, would be a good place to go if you're having these symptoms, particularly if you've had poorly controlled diabetes for a while, and if there's any concerns that it might be coming from your heart or lungs. Without seeing you and without doing any further assessment, that's probably as broad as I can speak about it at the moment, but those are the things to consider.
Thank you, Dr. Bruce. We appreciate that. Dr. Evelyn, the question that we have for you is, Doctor, when you refer to a high carbohydrate load in the diet as an immune response suppressor, are you speaking about refined carbohydrates, or are you talking about all carbohydrates?
Yeah, so when it comes to a high carbohydrate load, it's basically any type of carbohydrate. So you find that for the refined carbohydrates, we tend to eat more of it to get to our satiation level in comparison to complex carbohydrates. So you'll find that we tend to sort of binge or overeat the refined carbohydrates. But in totality, if you eat anything above its stipulated amount, then yes, you do increase the specific dynamic activity of that particular food.
Okay, thank you. Thank you for that.
Yeah.
Renier, the question that one of our listeners sent in is, how long will the ground seeds, the flax seed, the sesame, pumpkin, sunflower seed, you gave a little recipe to get in the right omegas, how long will it last in the freezer after it has been ground into powder? And also, since it will only retain value only for a week in the fridge, does it mean that the already ground flour in the store is not too good for us?
So when it comes to the freezer, obviously many people would freeze food and they would eat it afterwards. I am personally not a great fan of frozen food, even from the freezer. But in our day and age, when many people, they cook food, they would eat the food for the day and then put it in the freezer. And even the flaxseed one, they would use it that way. But I do believe over time it will lose nutrients. But in the end of the day, the best is to have it fresh, to use it within 7 days. It's always the best way to use. And then obviously to buy it in the shops already fine. In the end of the day, let me use another example. If you were to buy canned beans versus dried beans that you cook yourself and then eat, there is a nutritional difference between the one and the other. The other thing is, so it's better to have the dry beans to cook it yourself. Just like the seeds, it's better to make it yourself, to grind it yourself, and then to use it. The other thing is, obviously, that product is lying on the shelf for how long if it's already in a fine form? Meaning it is already gone rancid, it's already not good for you anymore. So the best is what we have seen when it comes to health is to do as much as you can yourself from scratch. And then you will get the best health benefits from these products.
Thank you, Renier. That's a clear answer. A question that I got was, which hydrotherapy technique would be best when dealing with fever, especially in children? Are there any contraindications or considerations when treating children? Well, what I've found over the years applying these principles is the easiest and the safest hydrotherapy using water procedure is called a wet t-shirt. And it's great and it's safe for everyone, from a tiny baby. I've had a few months old baby on a camp that got a pneumonia, and we used the wet t-shirt treatment on this little baby, and really there was a difference within this baby in hours. So you can also use this for older and frail persons. You have not asked me how to do this procedure, the one that asked this, so I will not do it. But there is only two safety precautions for this procedure that I need to mention. Don't use cold on someone who is feeling very cold already. This does not mean that you cannot do a wet t-shirt if someone is feeling cold, but rather it means that you need to put two safely placed hot water bottles at the person's feet to help the body to warm up. And in about 10 minutes, while the person is lying tucked up warmly in bed, the fever will begin to drop. We have tried many methods in bringing a fever down without pills, and this one comes out the clear winner every time. So in about 10 minutes from tucking the person into the bed, the temperature would start dropping. And remember, especially with a disease like COVID-19, fever is actually your friend. It's not your enemy. So we need to just control it. We don't want to break a fever, because it is that heat that's actually going to kill off the virus at the end of the day. If the person will almost invariably experience a quality deep sleep after this treatment, then that would be the best. No hot water bottle needed if a person is not feeling cold. So I take it that you understand it. It's possible to have a fever and feel cold and shivery, and at the same time, all of this at the same time. So please look at the DVD set called Healing Power God's Way, and I think that is the gift that you could have claimed, Healing Power God's Way, and it is still available on the Surviving a Pandemic platforms until midnight tonight. So there is a very clear, detailed explanation of how to do these different treatment modalities. Even the wet t-shirt one there, it's very clear in that DVD set. Dr. Bruce, are you ready for a question?
And I'm back.
All right. So what causes the grinding of teeth in one's sleep? And I'm listening well because my wife is waking me up with that one at night. So yeah, please help us.
So grinding of teeth is called bruxism, B-R-U-X-I-S-M, bruxism, and it can occur during the day or the night. You're specifically referring to nocturnal or nightly bruxism. And again, there's a number of different potential causes. Stress and anxiety and tension in the short term can cause bruxism. Again, mental health issues like depression and anxiety, certain medications can cause bruxism, but generally it's going to be a combination of psychological tension and stress, and that's going to be the main cause, and possibly some medication side effects itself. So some of the medications that are actually used to treat anxiety and depression can actually cause bruxism, which is rather ironic. So some of the antidepressants, for instance, can, while they're both the cure, they can also be the cause of bruxism. The cure for the anxiety, they can as a side effect cause bruxism. So again, a comprehensive approach would need to be taken. If it's an occasional thing and it's not affecting your dentition, and it's a passing phase where there's been an acute stressor, then that's probably not so significant. But if it's a persistent ongoing thing, then you're going to start affecting your dentition. You're going to start wearing your teeth down.
Yeah.
You can put strains on your joints, your temporomandibular joints. You're going to have tenseness in the masseter muscles that control your mandible and your chewing action. So if it persists, you need to see your doctor. You need to speak to perhaps your GP as a start. You need to look at some of the dental implications with a dentist or a maxfax, a maxillofacial surgeon. But that's the general approach. Stress, tension, anxiety, not relaxing properly, something that's troubling one, and medication side effects would be the main types of causes.
Thank you, Dr. Bruce. We appreciate that.
No problem.
Dr. Evelyn, there was this little question. Thank you, Doctor, for a mouthful in a very short time during your presentation last week. Is it possible to give us a short summary?
Okay, so
Dr. Evelyn, are you there?
thank you for those comments. Yes, indeed, it was
Yes.
quite a mouthful. Yes, can you hear me?
Yes, we can hear you.
I think my connection is a little unstable. Okay, so I was just saying thank you for that question, and thank you for tuning in and listening to that mouthful about the introduction to the immune system. So I know there was a request to have it in PDF form to allow for easier reading at a later date, and that's something that can be planned or something that we can discuss on email. So maybe you can leave us an email address. But in terms of the summary, so it's just basically to say that our immune system is our ultimate defense. It has two main arms, which is the innate arm and the adaptive arm. The innate arm tends to be the first line of defense and involves some of our physical attributes such as our skin and our mucosal membranes. It also involves some cells, like your natural killer cells and your macrophages. And the adaptive arm is more towards the T cells and B cell activity, something that has to be triggered off or kick-started when the innate immune system is overwhelmed. We looked at the various influences of our immune system. Top on the list was the human microbiome. We discussed rest, having ample sleep, ample time to rest in the afternoon if it's possible. We discussed sunlight, and what has been proposed is at least 20 minutes of sunlight every day if possible. We know that we live in different areas and the seasons may interfere with this exposure to sunlight, but when you do get a chance, do it. And the good sun is the one that does not cause sunburns on your skin. So at the point your skin starts to burn, then that's too much sun. And the darker your skin, then the longer the duration you need to be in the sun. We also discussed exercise, and that when you exercise, it helps to release the immune cells that help us fight disease. And with subsequent talks, we also saw the importance of nutrition and the importance of water when it comes to our immune systems. So in the wake of COVID-19, yes, let us do the best we can to just rev up our immune cells and help them to fight off any disease that may be lurking. It's not only corona that we need to be aware of or scared of, so to speak. So I hope that helps. If you need any further information, please drop us an email and we shall be able to get back to you.
Thank you, Doctor. We do appreciate your time and helping us with this.
You're welcome.
I've got a question here for Renier. Renier, the question is, I'm diabetic. I'm a type 2. I was following the presentation on nutrition 2 on breakfast, and the suggestion was 5 fruits. Can this work for diabetics?
Okay, so obviously there's a difference between refined sugar and the sugars we find in fruits. And I know for certain that a lifestyle center like Pastor Arnold is a part of, the Be Free Lifestyle Center, it almost doesn't matter what the disease, the diet stays the same, because the answer is the same when it comes to our lifestyle most of the times. Obviously you'll tweak here and there depending on the ailments. But I think the main answer is to know that the fiber with the sugars in the fruit gives a slow release of the sugar and not a spike in the sugar levels because of the fiber that's within the fruits itself. So there is a difference between refined sugars shooting up your blood pressure and then coming down compared to eating fruits. There was a lady in a small town.
Sorry, Renier. It's
Yes.
not shooting up your blood pressure, it's shooting up your blood sugar.
Sorry,
Yeah.
blood sugar. Sorry for
Yes.
that misuse of a word. It's the blood sugar. There was a lady in a small town where we used to stay at a feast in. Her sugar levels was 26 on a regular basis. She lost one leg, she lost a finger, was about to lose her eye. The doctor said they could not operate because of the bad state of her kidneys. And for 7 days, she ate just our food. We did nothing special. We just gave her the food we ate. And we told some of our church members to cook the same food with the same type of spices, Himalayan salt. She gave her reverse osmosis water with salt in it and helped her to do a little bit of walking and just to follow what we do as a family on a weekly basis. Her sugar went from 26 to 7 in 7 days. The doctor took her blood and a urine test after 7 days, and he said, "This is impossible. This can't be yours." And she said, "But it is." And they could operate to save her eye. So the point is, in the end of the day, if you just follow this biblical diet given in the book of Genesis, it will already, you will see a great change in your life, which would include, of course, fruits.
Thank you. Thank you, Renier. Well, I've had another very interesting question, and the question is, which hydrotherapy techniques would you suggest for treating septicemia? Now, septicemia can easily be a life-threatening condition. It means an infection has gone throughout the body. It requires a visit to a doctor or a clinic first. So don't try home remedies alone unless you really know what you are doing. If the person was pretty sick, I suspect they would be admitted to a hospital. Septicemia would mean fever. So you could do the same thing, to control the fever. I would suggest you could use a wet t-shirt treatment modality, and that would not clash with any other treatments or therapies. But I must say I'm really nervous to give further advice because there's still so many unknown factors about this person. So it was just, a blanket question. There's just too much information that's still needed. So yeah, that's basically what I would suggest. I would say get a proper diagnosis, get a proper treatment protocol, and we can control fevers and so on with like the wet t-shirt model. Now, I've got another question here, and that is any recommendations on how to treat endometriosis with natural remedies? Now, I'm not sure why I'm getting all these very difficult questions, but let me try this. Endometriosis is where the cells that line the uterus escape through a fallopian tube that lies on either side of the top of the uterus and implant themselves onto your colon or the small bowel, the fallopian tubes and the ovaries. And this causes a real pain that nobody would know anything about if you didn't have it, and infertility. The success of stopping those depends on how much of your lifestyle you are prepared to change. Endometriosis is driven by too much estrogen and having the wrong types of estrogen in your body. So most of the estrogens come from animal products. So if you eat a female cow or drink cow's milk, for instance, then you are not only getting the cow's own estrogen, but you also get the estrogen from the hormone implants that are given to the cow to make it produce more milk and more beef. So none of these estrogens are natural to human body. And studies show that the only successful way of eliminating endometriosis is by going onto a low-fat, healthy, plant-based diet. There are some herbs that can be used together with the diet. In our center situation, we use wild jam, and we've done this successfully for many years now. And the body will then convert substances in the wild jam into progesterone. So estrogen and progesterone are like opposite ends of a seesaw. When one is up, then the other one is down. And the body will only convert what it needs. Month by month on this protocol will bring improvement. And I've seen this. I've seen this so many times. So now that's what I would like to say in short. Maybe I could ask Dr. Bruce, maybe if you know something else natural that you can add to this, it would help.
Yeah, so that's a very nice overview. Thanks, Pastor Arnold. So basically, endometriosis is endometrial tissue outside of the site where it belongs, which is inside the uterus. And essentially, the problem with it is that as the lady goes through her monthly cycle, the estrogen content rises during the first half of the cycle, the progesterone content rises during the second half of the cycle. So in an average 28-day cycle, you've got an estrogen predominance initially, followed by a progesterone predominance at the end. The problem with endometriosis is that the endometrial tissue is also going through this fluctuation. And so the function of estrogen in the first half of the cycle is to build up the endometrial layer so that if an egg is fertilized, it can implant inside the uterine wall. The function of the progesterone is to trim that thickening, that secretory endometrium down to make it favorable for implantation. So the two hormones are doing different things to the endometrium during the different parts of the cycle. And the problem is when your estrogen falls, then you get the menstruation, but that process is also happening where the endometrial tissue is sitting where it doesn't belong. So you're getting inflammation, which is what causes the pain. So in addition to what Pastor Arnold says, I think that's very, very valid, is that the more estrogen in your body, the more secretory or proliferative or thick the endometrial tissue is going to be. That's true. You want to avoid xenoestrogens. That's very, very fundamentally important. But apart from that, particularly if one is still thinking of having a family, you can't just afford to leave the endometrial tissue where it is. Sometimes you need to. So we generally, from a medical standpoint, is generally approached with hormonal manipulation and various contraceptive pills and things like that. They are often used to control the symptoms, but it's not the ultimate cure. And the point is that if this endometrial tissue is sitting in a place where it's going to affect your chance of fertilization or fertility, you might need to consider having it removed laparoscopically. So they use a camera to find out where these endometrial deposits are sitting, and they can actually remove some of those or ablate some of those endometrial deposits. But certainly from a lifestyle perspective, you want to be on an anti-inflammatory, low estrogen input type of diet to mitigate some of those factors. But over and above that, if they're becoming significantly problematic, you might need to have some of the deposits removed.
Thank you, Dr. Bruce. Now, I think we've done very well for time. I thought that we would have too little time, but I think we're still okay. We've planned this question and answer session for about 1 hour. I think we've got about 7 minutes left. And I wonder if there's any questions from our live audience that you would like to ask at this point. Any questions from our live audience? We can ask our technical team just to help unmute if there's somebody that would like to ask a question.
Pastor,
I see Velda Adrianza. Is that right?
Yes, Pastor.
Yes.
We're looking for a remedy for migraine headaches. What would you advise, Pastor?
All right, maybe I can maybe I can ask our doctors to help me in this one. Dr. Evelyn, do you have an answer for a migraine?
So basically, migraines are headaches that we have that tend to be one-sided, and it's quite a large topic. When it comes to headaches, that's quite a large topic, and there are various aspects of it that need to be addressed. As Dr. Bruce said, a good history would suffice just to find out when you do have these migraines. Are they every day? Do they vary in terms of when you're away from work or when you're at work? Does it vary with diet? Are there any particular foods you find that make it worse? Is there anything that you do that makes them better? So all these questions sort of just try to arrive at a better understanding of the migraine and what could be causing it. And then from that, then we can be able to sort of have a treatment plan for you. So, and also the kind of medication you're currently taking, and if it's helping in any way, and the environmental influences that may be currently ongoing in your life at this time. Maybe Dr.
Thank
Bruce
you,
can
Doc.
add something.
Yeah, I would just say with migraines, it's very important. Thanks, Dr. Evelyn. It's very important to be sure that you're actually dealing with a migraine headache, because a lot of the time people have severe headaches and they just label them as migraines or migraines. You know, so a migraine headache is a very specific type of headache syndrome. So headaches are caused by different things. There's headaches caused that are related to systemic illness, can cause a headache. Intracranial pathology or problems inside the head, craniofacial syndromes, so things like temporomandibular joint dysfunction, and then finally the headache syndromes themselves are things like migraines, cluster headaches, and tension headaches. Those are called headache syndromes. So very important with migraines is to make sure that you're firstly dealing with a migraine. A migraine tends to occur sort of once or twice a week maximum. On average, it's associated with certain types of symptoms. You can get photophobia, which is sensitive to bright lights. It's a vascular headache. It tends to be caused by vascular vasodilation inside the brain substance. So my advice and my counsel would be to make sure that you're definitely dealing with a migraine, because that will affect your approach and management. And as Dr. Evelyn said, is that you need to look for environmental and dietary triggers. Those are very common. So certain things like, for instance, people that drink alcohol, red wines and things, tyramine containing foods, some of the cheeses, some of the chocolates, these things can trigger migraine headaches. So first make sure you're dealing with the right headache syndrome, look at environmental triggers and stress responses as well.
Wonderful. I hope.
Thank you.
Sorry.
Sister Velda, you had?
Thank you, Pastor. I think I'll have to just take it to a doctor to be seen. Thanks for your input.
Pastor Arnold, there's another question there. Galaxy 18, who's Galaxy 18? You can go ahead, Galaxy 18. Pastor Pierre, can you just unmute him, whoever it is?
I tried, but I see there's another hand.
Pastor Arnold?
Yes.
Pastor Arnold Alexander.
Yeah,
You can go ahead.
Thank you. Good afternoon. Thanks for the informative program. I put the question in the chat, but my question is, curcumin or curcumogen, is it safe to use this as a maintenance anti-inflammatory and antioxidation medication? Did you get that?
Yes, I got that.
I see Pastor Arnold is just offline at the moment. You'll come back now. Dr. Bruce or Dr. Evelyn, if you can just answer that question for us, please.
Yeah. Thanks.
So curcumin has been demonstrated to have powerful anti-inflammatory properties. It's the active ingredient in turmeric. And so instead of taking bucket loads of turmeric to get your curcumin content, you can actually take an isolated curcumin supplement. But it again depends on what you're trying to treat, you know, and the severity of what you're trying to treat. I'm not aware of any long-term consequences to taking it over time. I think it's, from what I'm aware of, it sounds pretty safe. But again, you need to make sure that the disease you're trying to treat is appropriately going to be managed by that supplement. And inflammation, again, is a manifestation of a problem. It's not necessarily the problem itself.
Yes.
So while it will treat inflammation, that's very generic. So if you're dealing with rheumatoid arthritis or lupus or an autoimmune condition or Crohn's disease or something like that, a generalized anti-inflammatory herb can be a powerful contributing, assisting agent, but you need to make sure you're dealing with the primary pathology as well.
If I may just follow up with that, then so what about taking curcumin as a maintenance regime for hypertension and diabetes?
Well, again, like, unless somebody else wanted to answer, sorry. The important thing to consider is that both of these conditions have an inflammatory component. So most of the lifestyle diseases are associated with a chronic inflammatory state.
All right.
So it does make sense to take make sure you're using plant compounds that have anti-inflammatory properties. But again, supplements are always at the top of your pyramid. They're not the base intervention. So if you're doing anything that you add as a supplement should be on the base, like I said previously, of lifestyle changes, that you're eating the right diet to start with, which is inherently an anti-inflammatory diet. So plant-based foods are by nature mostly anti-inflammatory compounds. This is the thing, is that yes, it can have a role to answer your question, but make sure it's an apex intervention right at the top of the pyramid, not just the sole modality of what you're doing.
All right, great. Thank you very much.
Thank you, Doc, for answering that question.
Pastor Arnold?
Our audience? Yes.
Pastor Arnold, we have a question on Facebook. Is fasting recommended for diabetics?
Okay.
Anyone?
Okay, and who is that question addressed to?
It doesn't say. Any doctor that can.
It doesn't say. Well, one of our doctors, maybe I can say a word of my experience, but one of our doctors maybe just help us.
If both can answer, doesn't matter.
So basically, one differentiates type 1 from type 2 diabetes generally as the broad categories. But essentially speaking, the answer is yes. A diabetic can fast, and as long as it's a monitored process. But particularly if you're dealing with a type 2 diabetic, the pathophysiology or the cause of type 2 diabetes is insulin resistance. And one of the best things you can do for insulin resistance is actually to fast, because one of the causes of insulin resistance is a body or a cell that's full of caloric input. It's full of calories that haven't been used. And the body, to access those calories, needs to cut the insulin down dramatically. And so before you can dig into your fat supply or your stored calories, you often have to get the insulin level down, because insulin is a packaging hormone. And one of the things that fasting does is it helps to lower your insulin. So particularly for a type 2 diabetic. Now, so fasting can be particularly beneficial. So yes, the answer is yes, it can be very appropriate. One should differentiate the different types and make sure it's a monitored process.
Okay. Thank you, Dr. Bruce. I agree 100% with you. What we have found is that when we do intermittent fasting, that is now daily fasting, we see a major change with diabetes in a very short time. We're talking about days. So that intermittent fasting means that in your daily cycle of eating, and then the period that you don't eat. So let me give an example. You eat your last meal at 3 o'clock in the afternoon, and you only eat the next morning at 9 o'clock. That gives you about 16, 17 hours of fasting. And we see a major response on that, a very good and positive one.
Mm-hmm.
Right, we've got Tembi that's got a question for us. Tembi, would you like to ask your question?
Yes, I would like to find out what can I do to control hot flashes, you know, when you reach that age as a woman.
Great, great. Dr. Evelyn, I know you're not there yet, but maybe you've got the answer for us.
Actually, no, I don't have the answer to that, unfortunately.
Okay.
I
Dr.
deal
Bruce?
with the little kiddies.
Okay.
So important to understand is that menopausal symptoms are a consequence of the ovaries failing as they get to that stage of your life.
Yeah.
So basically, the ovaries are producing, like we spoke of previously, they're producing estrogen and progesterone, and these hormones are feeding back into the brain to control their own release. And one of the hormones that controls the release of those of estrogen and progesterone from the ovaries is a hormone called FSH, follicle stimulating hormone. And menopausal symptoms are largely what we call vasomotor symptoms. So they are, the flushing is a consequence of your blood vessels dilating and contracting. And it's related to the fluctuations of these hormone levels, particularly FSH. So essentially, again, you want to be on a healthy plant-based diet. You want to be getting your exercise. You want to be making sure you're well hydrated, that you're controlling your stress. Those are the baseline interventions. Those are always going to be the givens. But there are, I don't know what Pastor Arnold and them have been using at the Lifestyle Center, but there certainly are plant-based estrogens that can be helpful as well if one has significant menopausal symptoms. So those are things like we call the phytoestrogens. And often people that are taking plant-based compounds like soy products and things like that will be getting a source of phytoestrogens in anyway. And these can help mitigate some of those symptoms. So essentially, when you provide an external source of what your body is no longer producing in a healthy way, you can settle down some of those symptoms. Hormone replacement therapy has come a long way since it started. When doctors first used to give hormone replacement therapy, it was a hormone derived from horse urine. And so those are long gone days. And that's not to say that all hormone replacement therapy is safe. What I advocate is a thing called bioidentical hormone replacement therapy. So basically, if one chooses to use a hormone to control your symptoms, one should use hormones that are the same as what the body produces, not false estrogens.
Yeah.
And at appropriate doses. And that's a monitored process that your doctor can help you with. But you need to work with a doctor who's used to dealing with bioidentical hormone replacement therapy. But again, that's one aspect. There are sort of natural products, things like black cohosh, I think, can also have a role, and the phytoestrogens that can help control some of the menopausal symptoms. It's important to bear in mind, just as a closing thought, that the hormones are very important, and we underrate sometimes how important they are. There's an old adage that I always say in some of my talks is that we don't, hormones don't decline because we age because our hormones decline.
Yeah.
And that's a very, very important point to get, is that so in health, ideally you want to keep your body's production of its hormones going for as long as possible in a healthy fashion. And there are lifestyle factors that play a role into that. So there are supplements, as I said, and there are bioidentical hormones that one can use to help as well.
Thank you, Dr. Bruce. We appreciate it. I think when you refer to what we use at the centers, we use a herb called wild yum, and it comes in a cream format. So and we've seen a great result with that. But I need to say it is totally hinged on a lifestyle program. You know, if you only use that but just do what you used to do, then you might not have the same effect. And
wild yam is quite rich, as you said previously, in progesterone. So the issue is when a lady approaches menopause, they tend to become progesterone deficient before they become estrogen deficient. In other words, for a while they are estrogen dominant. So there is a time for a lot of the ladies that where purely progesterone supplementation is helpful, because that's the first hormone that goes when they start to lack the production. So
Thank you. Well, there's more time for we just heard word that we have got a bit of an extension of time. So if there's any other questions,
I have another question here, Pastor Dio, on Facebook.
Yes.
Comes from for Dr. Bruce. it's a brother who's on dialysis. He asked, how can I increase my blood pressure post dialysis? Because after that, his BP drops to 73 over 50, 58. And he gets out of breath after that.
Yeah. Yeah. So unfortunately, you know, dialysis is a very complex process, and it's reproducing something that God has done in the size of a kidney, which is just incredible. And one of the kidney has very, very many important roles. And one of those functions is fluid balance control, controlling of our fluid status. It's as our professor at med school used to say, it's not that just the function of the kidneys to produce urine, it does so many more things. But one of the things it does is it controls our water balance as to how much body water we're retaining and how much we're letting go. So when you're having dialysis, they're controlling your electrolytes, they're controlling all sorts of things. But one of the things they're controlling is your fluid status of your body. How much net fluid is in your body before and after the dialysis process. Because when your kidneys are not working, especially in end-stage renal failure where you need dialysis, your body over time, before the dialysis happens, is accumulating fluid. And so one of the things the dialysis is doing is dropping that fluid content dramatically, which is why the BP is dropping. Your blood pressure is related very much to your intravascular volume. So there is the potential that one can over-dialyze somebody. You can take off too much water, and that will drop their blood pressure. So the answer to the question is to make sure, firstly, that the amount of fluid being removed during your dialysis protocol is appropriate for your pre-dialysis status. So when they do dialysis, we determine how much volume we're going to remove during the dialysis process. And that must be decided before you start the dialysis based on your fluid balance charts. We use fluid balance charts in ICU to determine how much you've taken in and how much you've gotten out, as to work out what sort of volume we still need to remove with the dialysis process. So if one is overcompensating for that and removing too much fluid, you can drop your blood pressure after the dialysis. That's important. That's the first and probably the most likely cause. Apart from that, it's just going to be making sure that you know how to balance your own fluid status with your chronic renal failure problem. Because kidney failure patients have to watch how much fluid they take on board. Because if you can't, as you can appreciate, if you can't produce urine, the pressure, the body fluid can build up to the point that the fluid comes out in other spaces in the body, like in the lungs. You can get what's called pulmonary edema. So most kidney failure patients will know what their fluid balance status is in terms of how much water they're supposed to take in during a day. Making sure that's correct, making sure they don't over-dialyze you during the dialysis process, and watching your electrolytes would be the main things to control your blood pressure.
Oh, thank you. Thank you, Dr. Bruce.
There's another one here from the same person, Pastor Neuhoff.
Thank you.
The next question that he asked then is, being on dialysis, I cannot eat wheat-based foods because of the potassium. I can only eat white bread. What else can I have healthier? What other options, healthy options, can you have for you as a person who's on dialysis?
So everybody needs
any wheat-based foods. That's what he says. Food. Yeah.
Yeah. So I think he's primarily addressing. I'm just trying to understand the question. I think he's primarily addressing the potassium issue. So
that's right.
One of the electrolytes that the kidneys remove is potassium. Potassium is one of those electrolytes that's got to. It follows the Goldilocks principle. It's got to be just right, not too much, not too little. And the kidneys very much tightly regulate how much potassium we hold on to and how much we excrete. When a person has chronic renal failure, they can build up potassium, or acute renal failure specifically, they can build up potassium over time. And too much potassium can stop the heart. So one has to be aware of what your potassium is doing, and then look at foods that are rich in potassium. Bear in mind that potassium has very important functions in the body. It's about keeping at levels that are safe for you. So wheat is certainly not the only food that contains potassium. It's not the only food to watch for. Potassium is mainly found in plant-based foods, greens and things like that. There's a lot of potassium in. So the issue is to be aware of which foods contain potassium and how they can impact on your body's total potassium content when you have chronic renal failure. And so your renal physician will be in the best position to guide you through those dietary factors that can contain potassium, and how much to have of those in terms of mitigating your risk of taking too much potassium on board. But generally, potassium is found in plant-based foods, particularly green foods. It doesn't mean you can't be healthy. You must just be aware of where the potassium concentration is the highest, and make sure you don't exceed your daily recommendations.
Thank you, Dr. Bruce. We've got some more time for questions. Any more from our audience?
Uncle Simon, I think.
May I ask
Yes,
a question regarding,
Uncle Simon?
regarding sleep? We're very aware of the structured system that takes place during our sleep cycle. What happens when I'm woken up in the middle of the night, either to go to the bathroom or a house alarm goes off, go back to bed? At what point does my body resume which cycle? Do I have to start from all over again, or do I click on to where I left off? Thanks.
Yeah, so the point being is that you want to minimize interruptions during the course of the night as much as possible. Obviously, sometimes if we've had quite a bit of fluid, we need to go to the loo, but you want to make sure that the lighting that you are using for that process is as least invasive as possible. So, some bathrooms these days have these lightings on the floor. You want to be using light that is not blue light dominant. If you have to use a light, make sure you use lights that are more in the infrared warm spectrum, like you get on your computer monitors towards the end of the day. Minimal light exposure, that'll have the least effect on your nightly melatonin production. How quickly you go back to sleep is going to depend to a large degree on your melatonin. As one ages, you produce less melatonin, so one tends to battle more with sleep and sleep less as you get older. So therefore, you have to be more intentional about protecting your melatonin production. But to answer the question, you go through, it's hard to say exactly which part of the sleep cycle you'll go back to. We go through 5 or 6 cycles a night of alternating non-REM and REM, and your body you'll probably go back through, start a new cycle at non-REM, going through light sleep back into another cycle that takes you back into REM sleep again, interspersed between non-REM and REM. But you'll probably start again at the light level of non-REM sleep and carry on.
All right. So Dr. Bruce, if I heard you correctly, I think what's important is, because some of us do have to get up, is that we don't put on the bright lights when we go to the bathroom. We must rather use a smaller light so that it doesn't wake us up properly.
That's it. Absolutely.
Okay. Thank you. Right, people, we've got another minute or two for a question. Any other questions?
There's a question for Renier.
Renier?
The question is, so for some people who doesn't have data and they have these facilities like Zoom and YouTube and stuff like that, they ask if it's possible that Renier can give us a Word document on foods to eat to boost your immune system during this pandemic.
Okay, so I can see if I can compile a document. We definitely have DVDs also available as a ministry, and under lockdown level 3, we are able to post. So I don't know how they're able to contact us personally, Pastor. You can maybe just tell them. But yeah, so there are DVDs available where we explain many of these foods, but I can also see if I can compile a document.
Okay. Thank you, Renier.
Thank you, Renier. I think we've got most people that have registered. We can send you a newsletter with some of these documents. So once Renier has set it up, we could send it out to you via the registration documents that you have submitted. I'm sure we can do that.
Yeah.
And yeah, you at any time you are welcome to contact Renier at the Preparation Ministry, and you can just Google that, the Preparation Ministry, and they will be available on that platform. Any other questions?
There's another one there for the doctors. I think it's Dr. Bruce. How effective is aspirin for blood clotting?
Yeah, so very effective. Aspirin is what we call an antiplatelet agent. So when you're dealing with anticoagulation or blood thinning, again, it depends on what your indication is. So there's a spectrum or a continuum of agents that we use to control blood thickness. Aspirin's the one that we start with at a sort of superficial level, so that affects platelet function, as I said. But then there's certain drugs that can affect the clotting factors and clotting pathways. Clotting is a very tightly controlled, amazing process that has been designed by God, which is incredible. There's this fine balance between clotting and keeping the blood thin. If we didn't have this, and these proteins are, anybody that doubts the design or creator just needs to look at the coagulation system to see how amazing it is. These proteins are insoluble, and then when there's an injury that exposes collagen and various tissue factors to these soluble proteins, they start a cascade which ultimately converts thrombin to various proteins. It's quite complicated, but they form a protein complex, which then the platelets get trapped into and form a plaque and stop the bleeding. So aspirin is very effective. It's an agent that affects the platelets and takes them out of, affects them for their whole lifespan. A platelet tends to last for about 7 days, each individual platelet. So that keeps the blood thin by acting on the platelets. But again, depending on what condition you're trying to prevent or treat, that will determine which blood thinner you use. Aspirin is only one of them.
Dr. Bruce, what we found in the lifestyle centers is the moment that we fix people's omegas, essential fatty acids up, you actually see a lot of that problems getting less. So if they use the 4 seeds that Renier has spoken about, people that go for tests, they would come back and say, the doctor said, we had to now lower your warfarin. In this case, it was warfarin. We had to lower it because your blood is nice and thin. And so we see that sometimes the Western diet that we eat will actually make us our blood thick, and we can do it from a natural point of view as well.
And of course, there are natural blood thinning agents too. The garlics and ginkgo biloba is a nice blood thinner. Inhibits platelet activating factor. There are natural agents that can be equivalent, but again, it depends on the indication, and one must be certain that you're using the appropriate agent for the right indication.
There's another one there, Pastor. I'm just typing it to you. Also on Facebook. It's about for cholesterol. There we go. Pastor here, that's for you. Can you see it?
I think he is offline again.
Okay.
Can we maybe Dr. Bruce?
Yeah, Dr. Bruce, I think Pastor Neuhoff is not online now. The question is on Facebook. What naturally can you use instead of somatostatin for cholesterol? What natural product?
Okay. So simvastatin is a statin medication that inhibits the production of cholesterol. It's quite a potent medication. A lot of people have side effects with it. First point I would make is that, again, make sure that your lifestyle. Pastor Arnold, are you back?
Yeah, I think so.
Sorry, you're still muted. There we go. So yeah, the question was just about alternatives to statin medications for cholesterol control. And I was just saying that, you want to make sure that you're choosing a lifestyle that doesn't put you at risk of high cholesterol to start with. The impact, the big things that impact your cholesterol level, I'm going to get to alternatives, is what you put in your mouth and how you move. There are genetic factors that determine cholesterol as well. Some people have what's called familial dyslipidemias or familial hypercholesterolemias. So certain proteins and genetic abnormalities in certain carrier proteins can affect how high your cholesterol is and what sort of lipid problems you might have. But those are more the minority. A lot of cholesterol issues tend to be lifestyle related in terms of what we put in our mouths. Different people respond differently to dietary fat intake. So as you know, there's saturated fats, monounsaturated fats, polyunsaturated fats, plant fats, animal fats. Animal fats by and large tend to be saturated fats. So you want to be avoiding, from a dietary, firstly, not all cholesterol is bad. Your body produces cholesterol. Everything that has a liver produces cholesterol. And that's why you don't actually negatively, if you on a plant-based diet, you have the best chance of controlling your cholesterol process because most cholesterol comes from animal products. That said, different people's livers are affected differently by the same amount of cholesterol intake. So for instance, if I have 50 grams of saturated fat, the net impact on my blood cholesterol might be different to somebody else's. But the point being is that from a dietary perspective, animal products are the chief source of cholesterol from an outside of the body point of view. So if you're on a plant-based diet, that's the first point you need to get under the belt, that provides the best chance of normalizing your cholesterol. If you combine that with exercise has been shown to favorably affect your HDL and LDL ratio. That's the good cholesterol and the bad cholesterol. So as you can see, the approach is what I put in, how I move. We're not just going to say, take this. You fix those things first and see what's left over. And statins are the end of the line if you're not winning. But in terms of a natural alternative, there's a thing called red yeast rice. Red yeast rice tends to have a favorable effect on cholesterol profile. Depends on what your cholesterol profile looks like. We use a thing called a lipogram, which is a profile in the blood that looks at your HDL, your LDL, your total cholesterol, your triglycerides, different ratios, the number of particle sizes, and things like that. But my answer to your question is I would take a tiered approach, make sure I correct the correctable lifestyle factors, see if your cholesterol is amenable to a supplement like red yeast rice or something like that can be of benefit. And then lastly, if that's all not effective, then consider a statin, but that's a last line resort for me. And also it's important to bear in mind that with most cholesterol lowering medications or supplements, particularly even red yeast rice, it's important to take a thing called coenzyme Q10 when you use these supplements for cholesterol, because the coenzyme Q10 production is affected by a lot of the cholesterol lowering interventions. And you need coenzyme Q10 to keep the cells healthy to produce energy, especially the heart. But that's the approach I would take in terms of a natural alternative. Pastor Arnold.
Oh, thank you, Dr. Bruce. I think wrapping up this session, I can encourage all that have been part of the Surviving a Pandemic program and series that you are very welcome to just keep your ear to the ground, because we will have a follow-up on the first weekend in July, where we would like to look at the effect of the pandemic from an emotional and stress level, and how does that affect the immune system. And so we would have one or two speakers that would speak on that at that point. And so we're going to send you an invite. If you are registered, you'll find an invite from us. And we would like you to ride this thing through. I want to thank Dr. Bruce for the big sacrifice that you've made to present and also be here, the time that you've spent. Thank you very much, Dr. Bruce. Dr. Evelyn, it was so great having you on the team, and thank you for your time and your expertise. We do appreciate it. And Renier, He's a family man with 2 young boys, and he's given a lot of time, not only compiling the information for us, but even being here today. So thank you, Renier, for your time and your investment in helping others. We do appreciate it. And I know that everybody appreciates the recipes that you have already sent out. I'm sure our listeners have received it. And thank you for helping us with just another compilation. And we do appreciate that so much. I would like to end off by sharing with you, and maybe I must just give a last word to all our speakers, and then I'll give a last word, something that was just like in my face, and I just need to share that with you. So Dr. Bruce, maybe you, and then Dr. Evelyn, Renier, maybe just a last word before we say goodbye to everybody.
Sure. It was lovely to spend some time with each of you. I wish I could see more of your faces, but I want to encourage you to make these changes in your lifestyle, put them into practice. And for a long time in my own life, I wasn't doing these things. And when I started doing them, I saw and felt the difference. And I did them because I felt that I was having the impact on my health by not doing them. So I want to encourage you to make small changes wherever you find yourself. God's ways are the best ways. Put them into practice and you'll see the benefit.
Thank you, Dr. Bruce.
It's been an absolute pleasure being part of this team. I'm so glad that we had quite a number of people who joined us, and we hope that the sessions were informative. And we also do hope that it's sessions that will help you through this tough time that we find ourselves in. Just try one at a time, see how that works, and I'm sure you're not going to regret it. And I pray that God will keep everyone safe during this pandemic. Thank you.
Thank you, Dr. Evelyn. Renier, all the way there from KwaZulu-Natal.
Very cold, Howick here. We're hitting -1 every night at the stage. So Natal is not all warm. Yeah. But for our viewers, you know, all of us approach health from a different personality perspective. Some of us want to be diligent and do it right. Others want to do it now. Some of us want to have fun while we do it. And others just, you know, will do it when others do it. The point is, in the end of the day, is that you need to make the personal decision to do it. You need to make the choice. No one, we can only bring you to the water, but we can't make you drink. And I made the decision 12 years ago, and I'm still reaping the benefits today. Pastor Arnold would not have been on this program if he did not make that decision. So make the decision. It will really transform your life to eat the way God wants us to eat.
Thank you. Thank you so much. Well, I can see the chairperson of the committee that has run this program, Pastor Brian Hartnick. His face we can see, and thank you, Pastor Brian, for the leadership that you took to make this program run. I also see the face of Pierre, and he's very close to me. He is my son, and thank you for the technical background for helping us to make this possible. All right, I want to end off with something that was in my face. Now I'm going to share something that's in a PowerPoint right now, and I have not verified this, so take it from me as not being verified. But I've just understood, and let me just try and get this up there, and I'm sharing it. And I don't know if you can see it right now. This lady. You can see it. I'm so glad, because at this point I cannot. This is the oldest living person in the world, and she's a Filipina and a faithful Seventh-day Adventist. And at the age of 120, she has survived 2 pandemics. So she's gone through the H1 N1 Spanish flu pandemic in 1918, and she survived it. And she's gone through the 2020 pandemic, and she survived it. And the inspiration is, let her strength and faith be our inspiration. And so let's just keep safe, keep our eyes on the right place, and do what we can do. And may God bless you all. Amen.
Thank you, Pastor Neuhoff. Thank you so much for everybody that has tuned in. And I'm glad Pastor Neuhoff, he announced our next session, which will take place on the 4th of July. I want to jump on that bandwagon of Renier. If you don't make a start now, it will be too late. I saw Pastor, did he run away now? Pastor Arnie. Pastor Arnold, Pastor Arnold Alexander, you don't mind if I call on you to close for us with prayer, please?
No problem.
Thank you so much.
Thank you for this program. Very informative. Thank you. Thank you for the initiative and sharing. Let us pray. Father in heaven, we know that you are a God of love and life. And so help us, God, to make wise decisions so that we may live and live well for you. Thank you for this platform where we were able to learn and to grow and to care and to share. We live in a very different world, God, from 3 months ago. And things are changing rapidly. And so we thank you for technology, where we can interact with each other at this level. Thank you for the organizers and the presenters. God, may we use this information that we've received as a catalyst for change, but above all, may we reinforce our relationship with you to help us through this change. This is our prayer in Jesus' name. Amen.
Amen. May you all be blessed. Amen. And keep well and keep safe. Amen.
Thank you. You too. Bye-bye.
Bye.
Amen. Thank you.